United Health denies 40% of claims while making over $1.2 billion a day. And we keep paying them. Right now, families across America are making the impossible choice. Drop health insurance completely because they can't afford $2,500 a month, or keep a plan so bad they're scared to actually use it. But here's what nobody's telling you. There's other options out there. And the one that I'm going to talk about, a third option, just saved me $1,600 a month. I'm going to walk you through exactly what just happened to me in the last couple weeks when I fell on the ice trying to take my daughter ice skating. And this was about 3 weeks ago. We went to urgent care. My wife walked up to pay the bill. And after an x-ray and exam, she turned to me and said, "Why is this so cheap?" The total was $210. We paid it just with a debit card. I filed the claim when I got home. I got reimbursed the following week $160 because my urgent care deductible is $50. My out-of-pocket cost, $50, and that's it. Compare that to a United Health plan I had before. $2,500 a month for a family of four, 2 daughters, ages 8 and 15, a $6,000 deductible I never hit, and a 40% chance that they would deny my claim anyway. So do the math on that. It's absolutely stunning when you start thinking about how much money you've spent on insurance and how little you've used it. They're making over $1 billion a day while denying 4 out of 10 claims from people who already are overpaying. That's not insurance. To me, that's theft. So what changed? Close to a year ago, I switched to a health share program called Mighty Well, and it's a health share paired with a minimal essential coverage plan. I pay $945 a month for a $1,500 unshareable amount. It's like a deductible. That's for all 4 of us. The most robust plan they offer, again, saving $1,560 every single month. That's over almost $19,000 a year back in my pocket. That's real money. That's real cash flow. And here's the part that shocked me. When you're using a health share program, you're paying essentially the cash price. You've heard of that rumor. If you pay cash, the prices are cheaper. Not the inflated pre-negotiated prices that Blue Cross or United Health have locked in. Those companies aren't negotiating for you. They're negotiating for themselves. The provider gets paid faster with cash. You get charged less. Now, I know exactly what you're thinking. But Darren, won't they just deny all of my claims? That's what everybody tells me. I hear it on a regular basis when I'm talking to folks about this plan. But let me ask you this. Who do you think denies more claims? I just gave you the stat. A health share program where members pool resources and help each other, or United Health, a company that denies 40% of the claims while raking in unbelievable record profits. I filed multiple claims. My daughters have used it. And by the way, I also have a network where all I had to do was pay my copay. I just used it for my 2 broken ribs, and I haven't had one denial, not one runaround, not one phone call where someone in a call center tells me I need to prove my injury was necessary. That's not the case. We speak to the admin team, and every single time they've been unbelievably helpful. The process is simple. Pay up front at the provider if you're out of network, or you pay your copay if they're in network. Submit your receipt and your medical notes, and then you get reimbursed according to your plan's sharing schedule. Simple. Done. I'm not sitting on hold for 90 minutes waiting on somebody to pick up the phone. I'm not fighting with somebody who's never met me and whether or not my x-ray was medically necessary. I'm not wondering if this will be a claim they will decide to deny. Here's the reality. The healthcare system in this country is broken. I think it's impossible for anybody to deny that. We all know it. Insurance companies have turned healthcare into a profit machine where you pay more, get less, and then fight for every dollar when you actually need the care. And I have specific examples in my life with my daughter who's special needs and was diagnosed with a rare disease. Your deductibles are too high. Your premium's insane. And when you finally need to use your plan, you can't because you haven't hit your out-of-pocket max yet. It's a system designed to take your money and give you nothing in return. Now, I want to be 100% clear. This is not for everyone. If you have pre-existing conditions, I'll be the first one to tell you that a health share program like Mighty Well probably isn't the right fit. Traditional insurance still has a place for people with ongoing medical needs. There's no doubt about that. I do agree with that. But if you're healthy, if you don't have any pre-existing conditions, and I'm not talking about high cholesterol or even type 2 diabetes or high blood pressure. If you're paying $1,500, $2,000, $2,500 a month for a plan you never use because your deductible is sky high, you need to look at something else. I work with clients every single day trying to help them increase their monthly cash flow. People are struggling to find places to save. The cost of living, as we all know, is gone bonkers. It's outrageous. It's almost parabolic. I've seen people cut their streaming services. They've refinanced their mortgage. They've done everything they can think of, and they're still drowning in these monthly premium payments for insurance that they just can't even afford to use. This is one of the best opportunities I've seen in years to put real money back into your pocket. And I'm not talking about $50 a month. I'm not talking about $100 a month. We're talking about $1,000, $1,500, and in many cases, $2,000 a month for families. Now, when I made the switch, I didn't do it blindly. I researched the heck out of this. I felt like it was too good to be true. I asked the questions. I compared the sharing schedule to my old plan's benefits. I looked at the exclusions. I made sure my family would actually be covered, and then I pulled the trigger. Best financial decision I've made in the last couple of years. My monthly cash flows increased by over $18,000 a year. My coverage hasn't disappeared. In fact, I would argue that it's better. My claims do not get denied. And when my wife asked why the bill was so cheap, I got to explain to her that we're finally paying a fair price for the system instead of getting beaten by it. If you're sitting there paying too much for too little, it's time to ask yourself a question. Why are you still funding a company that denies 40% of their claims while making over $1 billion a day? There's a better way. You just have to be willing to look at it, be open-minded, understand it, do a little bit of research. And I'm telling you right now, it will change the way you think at healthcare. My name is Darren Hunter. That's another guaranteed video. This is a great way to save. This is a great way to increase your monthly cash flow. My family is truly on this, and I cannot tell you how happy I am I made the switch. I encourage you to look out and see what will benefit you. And if it doesn't, thank you for the opportunity. I wish you the best. Stay safe out there. Good luck. Guaranteed.